There we go. Good morning to everyone. Welcome to the March edition of the Health Innovation Team meetings. We look forward to hearing some great things this morning. We've got Matt Gunter from Routine Success with us, and looking forward to also hearing from Dr. Bob Dudzinski from Digital Conversation. So we'll just kind of jump right in with starting with introductions. So I'll kind of guide you through that. If you just say your name and organization and a brief hello, that would be welcome. So let us start with Bob. Go ahead, please.
Good morning, everyone. Bob Dudzinski, CEO of Digital Conversation. Been here before, glad I'm back.
Great. Chuck.
Yeah, Chuck Schneider, Red Point Summit. We help healthcare systems and vendors reduce process with automation.
Okay, let's go to Dan English.
Dan English here, University of Kansas School of Nursing.
Great. Doug.
Doug Kohulin. I'm with the KU School of Nursing on the advisory board, as well as I work on artificial intelligence and healthcare.
Elizabeth.
Hi, Elizabeth Crocker from founder and CEO Emerald Venture Partners. Our two main services are working in digital health and connected health, as well as research and testing for medical devices and med tech companies.
Great. Jenny.
Sorry. Hi, this is Jenny Marshall. I am the Director of Strategic Planning and Strategic Outcomes for Strategy at Children's Mercy in Kansas City.
Thank you. Anurag.
Good morning. My name is Anurag Patel, CEO, co-founder of Abada Health. We do digital health analytics as well as security, and I'm here with the health innovation team.
Bobby.
Abby Cultifider. I'm with LHH Recruitment Solutions right here in KC. I happen to be an RN by trade, and then I've been working the last 2.5 years as a tech recruiter. So I've worked for several health companies, and I'm happy to be here, learn more, meet all of you, and help wherever I can.
That's great. Great to have you. Thank you, Bobby. Brandon.
Good morning, everybody. My name is Brandon Haggard. I work with the Economic Development Corporation in Kansas City, Missouri, specifically in the health and life science space. So all things development in the Kansas City, Missouri area.
Great, thank you. Chuck. Did we do Chuck already?
Yeah, I already went.
Okay. Sorry, I'm working on a dynamic list here. I apologize. David Varang. David? I guess I'll introduce Dr. Varan. He's a family practice physician at University Health, as well as a professor at University of Missouri, Kansas City School of Medicine. Let's see here. Jeff. Jeff B. Blackwood. All right, nobody's wanting to speak up this morning. Sorry. Jeff? Okay. Jim Starcett.
Jim Starcett with KC Digital Drive.
Great. John Travis.
Hi, this is John Travis. I am in consulting and used to be at Cerner for many years.
Thanks, John. Kendra.
Hi, everyone. I'm Kendra Crispin. I'm the Assistant Director of Events at BioKansas. We're a nonprofit focused on growing the biosciences ecosystem in Kansas.
Welcome, Kendra. Matt Gunter.
Yes, hi everyone. I'm Matt Gunter. I'm one of the presenters today, speaking about my passion project, Routine Success, that I'm sure I'll provide you more details on. My day job, I am an executive at SelectQuote in Overland Park as well. So I'm doing this this venture with Routine Success in my abundant free time.
That's another connection that we have, Matt. Tim Danker and I worked in London together.
Tim is a great guy.
Yes. Nick.
Hey, good morning, everyone. My name is Nick Spolita. I'm the RVP of Health Plan Solutions at Included Health.
Sarah.
Hi, everyone. My name is Sarah Sorek. I'm a Program Director for Digital Strategy at University of Kansas Health System.
Rebecca.
Hi, everyone. I'm Rebecca McKinnon, and I'm a consultant and a longtime veteran in the healthcare IT space. Worked for Cerner for a period of time.
Shannon.
Hi, everybody. I'm Shannon DiMaggio. Apologies for no camera. I'm driving right now. I am the Sponsorship and Events Manager with IC Stars Kansas City, which is a workforce development program in tech.
Great. Stan.
Hi, good morning, everyone. I'm Stan Edovich, semi-retired faculty on KC, consultant in pharmacology.
Thank you. Steve Crop.
Hey, good morning, John. I'm Steve Kropp, the Director of Telehealth at the University of Kansas Health System.
Great. Thanks, Steve.
You bet.
William.
Hi, everyone. William Crumpler, Program Analyst with KC Digital Drive.
JD.
Hey, everybody. JD Tyler, I'm a physician, owner and founder and CEO of Just Ask Evie. We do real-time peer-to-peer EMR support for physicians and nurses, really anyone using it. So happy to be here.
Great. And also on the line with us is Amy Teskey, who said she has some audio problems. Amy is an industry consultant, particularly in marketing and sales, and has worked with is Kansas City based and works with a number of Kansas City clients. Is there anybody that I missed?
Hey, John, it's Steve Sewell, and I'm also driving, and I apologize for no camera, but with Xenochips Diagnostics, we provide pharmacogenomics in the greater Kansas City area.
Great, thanks, Steve. Anybody else?
Hey, John, I think I figured out my mute. This is Jeff Blackwood,
Okay.
Director of the Commercialization Ecosystem at UMKC's Innovation Center.
Great, thanks, Jeff. Okay, let's get started then. I'd like to first to introduce Matt Gunter, founder of Routine Success. One of the things I guess I find really interesting is that Kansas City really is becoming a little bit of a mini hub or a mini nexus point for people who are applications for people who are neurodiverse. And I really find that kind of an exciting direction in our ecosystem and economy, and Routine Success is a great representative of that. And I'd like for Matt just to go ahead and let us know more.
Thank you, John. And I do have a few slides I'll share. I'll try not to make this too long-winded, but I think it'll provide a little background for the group. So the application is Routine Success, and just a second, I'm having figure out how to advance my slides here. As indicated during my intro, this is really a passion project for me. And it started because I have a neurodiverse son. My son, Peter, is now 18 years old, and he is, this needs to be updated, about to graduate from Rockhurst High School in Kansas City. He was diagnosed at age 8 with autism spectrum disorder and ADHD. He's always been a very smart, academically successful young man. He was always in mainstream schools. He went to Visitation and then to Rockhurst. Many folks don't even know that he has a formal diagnosis. They just think he's a little quirky at times. But he really struggles, as many high functioning autistic young people do, with executive functioning, organization, staying on task. He has a lot of struggles with things like personal hygiene, et cetera, that he's working on. There's no doubt in his mom and my mind that Peter can go on and do great things with his life. He plans to attend the University of Arkansas next year and major in data science. They have a leading autism support program down at the University of Arkansas, something that for UKU people on the line, I really wish the University of Kansas would embrace as well, but is not there yet. So he will be matriculating to the University of Arkansas, and we believe with the help and support provided by that autism support program, he'll be able to graduate and become a very productive member of society. But routine success is really built to try to help folks like Peter. They could be neurodiverse. In some cases, maybe they just need a little extra help with organization. What makes it a little bit different, and I'll show you some slides in a second, than other kind of task management or productivity apps that there are many of out in the app stores that you'll find on your phone, is that it creates a back and forth between a mentor and a mentee. So somebody like my son who needs that little extra support and counsel from, could be mom and dad, it could be a coach, it could be a counselor. It creates a back and forth with them, and that's what we think makes it a little bit different than some of the other productivity apps that are out there. I do have a co-founder, Connor Kelly, who is unable to join us today. He likewise, this is very much a passion project for him, as he has a nephew, Aiden, who's very similar to my son, Peter, just a little bit younger. Okay, so with that as background, I'm sure a lot of you on this call are very familiar with some of these unfortunate stats, but given where we're at in this country from a labor shortage standpoint, it is truly tragic that we have such a high dropout rate amongst four-year college students with disabilities. We have many of these students who finish high school and frankly don't know what path to pursue after college. And then as you see in the lower right, the unemployment rate amongst young adults on the autism spectrum is truly unacceptable. About 2/3 of all of the young people on the autism spectrum are unemployed, despite many of them being like my son, who have very high IQs, very high cognitive ability. They just really kind of need some extra support with some of the other factors in life. So what is routine success? So it's a pretty simple app. What it does is it provides prompts throughout the day for the young people using it to be reminded of things that they need to do. That could be remembering to turn in an assignment that they finished last evening. It could be remembering that they need to brush their teeth and comb their hair every morning and take their meds before they get out the door. It could be trying to improve their independent living skills, things like working on doing their own laundry and keeping their living space clean. but it provides those extra types of prompts. As you'll see in just a second, we utilize phone camera functionality so that we provide example photos of what successful completion of the task would look like, as well as this is an optional feature, but you can actually require a photo back from the user, and then provide coaching and feedback on that finished product. And then lastly, we have built in some reporting and reward functionality. For you technologists on the call, and I am not one, we have worked with a third-party developer. Technically, what Routine Success is right now is a progressive web app, so you will not find it in your iOS or Android marketplace yet. A progressive web app, I have learned, along with the other non-technologists on the call, is essentially a fancy way to say that it is a website. So it will work on any internet-enabled device. Obviously, it is optimized to work on a mobile device, but it can work on a desktop. It can work on an iPad as well. So these are just a few screenshots that I think illustrates the interaction between me as Peter's mentor and then Peter as the mentee in terms of how he uses the app. And then I'll tell you a little bit more about, the user base beyond just our family unit. But I'm sorry for the horrible selfie of me in the upper left-hand corner, but this gives you an idea of what a routine might look like. So this is Peter's morning hygiene routine for the days of the week. So Wednesday, Friday, he starts school a little bit later than he does on Monday, Tuesday, Wednesday. So this is called morning hygiene late days. You simply name the routine something, you tell it a start time, and then you have the option of that being either a repetitive routine or not. And you can determine, in this case, we want this to fire every Wednesday and Friday at 7:45 a.m. So at 7:45, Peter will get a text message that will say, hey, it's time to start the morning hygiene late days routine in Routine Success, and provides him a link to click on to take him into the instructions that he needs to complete within the app. You can see I provided that awful picture as an example of what we would like him to mimic back to us, because in this case, we do want to make sure that he has remembered to comb his hair and brush his teeth, thus the overly large smile to make sure that he's actually brushed his teeth, and that he's wearing a collared shirt as is required by his high school. And then you can see still in frame number 1, you can list any number of specific task level steps that are required to complete that routine. Pane 2 shows you what a day in the life in Routine Success looks like. This is integrated with Google Calendar as well. So you can also see this just on your normal phone calendar. As mentioned before, at the assigned time in Pane 3, Peter would go in and complete that routine. And then I, as his mentor in Pane 4, would get a text message at that time saying, hey, this has been completed. Go in and review it. I can see what he's done. I can offer him feedback. And then we've built a hopefully motivating reward functionality into it as well, which is simply the ability to, when approved, I can give him a certain number of points towards a mutually agreed upon goal that is tracked in the system. In this case, he wanted to, this was a few years ago, wanted to go see an R movie with his dad. So we're working towards 1,000-point goal total to get that. You can see some of the other rewards that he's earned over time. The other alternative is I can click that needs work button, which would then route it back to Peter for him to take another try, along with all of the feedback that I've provided in this particular case. So I'll pause there for a second. That in a nutshell is what Routine Success does. Again, the target is really I would say neurodiverse young people particularly, but really any young person who needs a little extra help with reminders and is working on those independent living skills.
Yeah, I see this very much as applicable to a lot of youth, frankly. Very interesting, Matt. How is there kind of, as we see in healthcare a lot, is there anything kind of like an alert overload? Do you get too many alerts or too many messages potentially?
Yeah, John, it's a great question. So obviously every child is different. But I do think from use and from feedback from other users, there is a limit to that, right? So you can overdo it and try to essentially micromanage every portion of the young person's day, and then it becomes effectively white noise, and you start to see them just simply ignore the alerts. So you got to find that right balance, and that threshold I think is going to be different for every user. I think another observation we had is when we started using this, we would build routines probably with too many steps in them. And so then what worked better in our personal family case was creating several morning routines with many fewer steps per routine, so that he could feel that success of completing the routine and submitting it and then moving on to the next one, as opposed to having one routine with 8 tasks in it. So
Do you provide templates for the routines? Is there kind of a starter kit?
I would say that is coming in the next version. So let me move forward a couple of slides. You know, where we're currently at is we are building Routine Success 3.0, and that we intend to be an actual iOS app. I think the primary challenge that we have had to date from a technical standpoint has been that the onboarding process is pretty clunky. So as I said, it's not a true app today. So first you have to effectively discover the app by me sending you a URL to sign up for it. And it relies on a process of the mentor initiating it and then sending an invitation to the mentee. So we are going to completely overhaul that onboarding process and allow either the mentor or the mentee to initiate the process, with the goal being that, you know, the user who is very excited about it when we talk to them about it. And then I think we've had some instances of users trying to start it, running into those roadblocks. They set it down, life gets in the way, you know, 2 more weeks go by and they say, oh, I want to do it again. I'll try it again over the weekend. So the goal being to try to get that onboarding process where people have built a profile and have built their first routine within the first 5 minutes. And I think that kind of canned, off the shelf, customizable routines will be part of that next phase. So
great.
Hey, Matt, Bob Dudzinski here. Can you talk a little bit more about the gamification? Do you see that having a life cycle to it? I mean, in other words, this effort was started with Peter at a very young age.
Mm-hmm.
You see that gamification continuing for the lifetime of the product, for the lifetime of the engagement?
Yeah, that's a great question, Bob. Thank you. So, you know, for one thing, I would say we probably don't have as much gamification in it as we should at this point. If you saw from the screenshots, it's still pretty basic in terms of design, and I think more gamification will be a goal. I think you're also touching on what is a broader question for us. So these are kind of the organizations that we're partnering with today. And I think we are candidly still trying to find exactly what the sweet spot is for routine success, both in terms of kind of the age of the end user and then potentially the diagnosis as well, And then lastly, who should be on the other side of the aisle as the mentor. We started off with this being targeted very much at families, with the thought being that mom and dad would be the mentors. We've had a lot of interest from college and high school autism support and executive functioning support type programs. But I think now we're maybe coming full circle to some degree back to the point where, we are working with college students at Clemson University and their autism support program, but we get some feedback of like, hey, these are 21-year-olds. They want more independence. They don't want, a mentor sitting on their shoulder. We built in more functionality for them to be able to do more things on their own. But I think a lot of the feedback that we've gotten is it would be great if we kind of worked on building these skills before they got to college. So we have also begun working with more high school and even kind of junior high age kids, coming full circle back to mom and dad being the primary mentors, along with, occasionally some parents and counselors engaged as well. So that is, I think, ultimately where we're going to land. And that would very much guide the type of gamification that we would look to build into it, so that, that maybe a bit younger audience than we've been working with more recently.
Doug.
Yeah, this is Doug Hohulin. A great concept. Actually, I have a nephew in his late 20s that might benefit from this. So is there a couple questions. Is there an age group for this? First of all, limit?
So I think, as just addressed, Doug, there isn't a specific age group where you'd say, hey, this is going to be insulting to your nephew. It doesn't have, ducks and bunnies or teddy bears or anything like that, where I think it would be insulting. I think what we have found is that it is most effective when there is that mentor involved. And I think there's potentially more receptiveness to working with a mentor. Obviously, every person's different, but at that slightly younger age. But certainly, again, the design is not going to be a turn off to your nephew and in his upper 20s.
Okay. Yeah, and I love this idea, especially, the having a mentor, and a human in the loop, right? Just opposed to like AI. Though, yes. I guess my one question is have you thought about like having a AI agent that kind of does some guidance too, especially if the mentor is not available, for like workflows and so forth? Because one area I'm very interested in is like case management in healthcare and AI. How do you make sure that whatever need or education case manager, right? So like when I have a question, it's like you Google it, or you say, okay, I want to watch a YouTube video on how to do X. How do I do a workflow? How do I do a home flow, right? Whatever task I need to do, I'm an engineer by training. How do I do it the most efficiently? And, I could see this, having this, an app. One is, I can connect with my mentor, but if my mentor is not available, or if I don't want to, interact with my mentor, I'd rather do an agent. I don't know if you've worked with Pi or any of the other agents out there, the chat bots that do a really good job of interaction. What's your thoughts on AI in this area?
I think that is a great question, Doug. So we are actually, you see Clemson University up here. They are using it at their Spectrum program. They have also provided an introduction to their computer science department. So we actually have, it's a very small sample size, but we have a computer science professor whose area of focus is really around kind of human machine interaction, particular to neurodivergent individuals. And so she and a grad assistant have done some, again, very small sample size initial research and are doing kind of a second phase study. And that's one of the things that actually the the college level users expressed a great deal of interest in, because as I said earlier, there is that hesitancy to some degree of like, hey, I'm 21 years old. Yes, I may be on the spectrum, but I'm trying to do more and more things for myself. I don't want a human mentor involved. But if you gave me an AI mentor to bounce ideas off of, that might be very interesting. I will be honest, that's not on our next 6 months development plan, but I would love to have a follow-up conversation with you if there are kind of like, I'm sure this is a bad term, but like an off-the-shelf solution that could be plugged in relatively easy, as opposed to us having to develop our own AI or anything. I'd be very interested in talking to you about that.
Okay, yeah, fantastic. Yeah, so is there a link that you can go to explore more?
Sure.
And then
yes.
actually, I'll reach out to you on LinkedIn to connect if that would be possible.
Yeah,
or
you
I can
bet.
send you my email address.
100%. So I'm happy to provide my contact information, and then I'll drop the URL for our app in the chat as well. But it's very easy to get to.
Excellent.
Thanks for the question.
Other questions?
So Matt, that last slide mentioned cash strapped, which what startup is not cash strapped, but so
Yeah.
are you actively trying to raise, or seeking grants, or?
So it's a great question, Jim. So I am obviously, I'm sitting here in a corporate office. I am not like the world's greatest entrepreneur. I know that. We raised a little bit of friends and family. We just passed the hat. I put some money in. My co-founder did. We had a few people just kind of say, I don't even need any shares. I just like what you're doing, and gave us a little bit of money. We've kind of used that up with the first 2 rounds of development. I would say, yes, we would be interested in raising, but in good conscience, I wanted to make sure that I have a full line of sight to that kind of primary question that I talked about before, in terms of like, what truly is the center of the bullseye for this? Is it a 7th grader who still lives at home, who's working on things with mom and dad as the mentor? Or is it more that campus environment of, Clemson and University of Central Missouri, Thrive program, et cetera? I think we're getting there now. I will be honest, like, we have seen slower adoption than I would like to see, because the thing that keeps me going is the fact that nearly every conversation I have, be they either with a clinician, an educator, or particularly parents like us who are willing to try anything to make their son or daughter a little more successful and independent in the world, the immediate reaction is like, this is fantastic. This will change our lives. Then I think, our onboarding process is not where it needs to be. So we lose that initial momentum where people say, I'm going to go home and do this. And then they run into some issue and they put it down for 2 weeks. And, that happens too often, I think. So what we're trying to do right now, if you saw in that same slide, is we are partnering with a couple of computer science almost graduates of Notre Dame who are going to take, it was built in, I'm getting way out in front of my skis technically, it was built in React, the progressive web app. So they think it's a relatively easy lift to get it to a true iOS app, and then really, really focus in on particularly that onboarding experience, again, with the goal of like, let's try to get somebody from building a profile to building their first routine within 5 minutes, and then put it out there and promote it and hopefully generate some revenue. And then that feels like that would be the right time to raise, because I do think we're back to really believing that the family unit, nobody's got, no offense to any clinicians out there, but nobody's got more of a dog in the fight than mom and dad. And they're probably ultimately the right primary mentors, we believe. So maybe not now, but certainly we would be interested in keeping the communication lines open.
Well, there might be
So-
worth a couple grant options that you could pursue in Kansas City too, so that might cover some of
I
that
would
additional
definitely be
cost.
interested in learning more about that if you'd be willing to chat a little bit more.
Yeah, happy. I mean, we'll take that offline, obviously, but yeah, happy
Great.
to have a conversation about that.
Hey, Jim and Matt, if you guys are up for it, I can be in that conversation too. I've obviously got a few connections here around
Great.
the autism community.
Yeah, good to hear from you, Jeff.
Sounds good.
Yeah.
Absolutely.
Hey, Matt, wonderful pivot from the watch app that you had. Everything looks great.
Thank you.
So, yeah,
Thank you.
This looks like it's really got some good legs to it. Congrats.
Thank you. Yeah, Joe, what Jeff's alluding to is I was in the Digital Sandbox, and this will show you I'm not a great entrepreneur, in 2016 with a first version of Routine Success that I'm probably guilty of always seeing the world through where we're at in our life stage as parents. At the time, my son didn't yet have a smartphone, and lots of device policies in school. So we built a wearable app on the Pebble platform that did the same basic functionality. This has more robust functionality with the camera, et cetera. But it still delivered reminders of like, hey, it's about time to change classes, remember your science homework, et cetera. Unfortunately, we used the proceeds from the Digital Sandbox round to build the launch-ready version of it on the Pebble platform, which then went out of business like a month after the code was completed. So lots of lessons learned from that. I got a new day job during that time as well, but thanks for the words, Jeff. We think this is hopefully that was good learning, and we're in a better place now.
Absolutely. And incidentally, as a Digital Sandbox participant, since I'm here at UMKC now, I can work with you and help champion some of your work here too. So
great.
Feel free to call me.
Great. Thank you.
Hey, Matt, this is Amy Teskey. I have a question. Well, first, just kudos to you. I think it has a ton of potential. I'm a pretty glass half full person in general, but like this resonates on many different levels. I'm curious, you'd mentioned executive functioning as well. From a go-to-market perspective, I'm a pretty big advocate of like really narrowing in, right, what's your product market, but so not to take us, down a rabbit hole here, but did you have successes in that particular kind of market line, or have you tapped into it much?
Yeah. So thank you for the kind words, Amy. And I would say we've not really done any marketing to date. It has been one-to-one sales. I think there's been a lot of receptiveness to it. Maybe part of that's the pro-social nature of the product, but we have, I've simply emailed directors of programs, and then they have either said, yeah, we want to buy this ourselves, or minimally, like I created a simple one-page flyer of what it does, and those would get passed along to parents who then have reached out to me and said, I want this thing, which I said, as I said, that's what gives me confidence that we need to keep going despite some of the issues with onboarding and, not having a lot of cash and time and everything, is the receptiveness to the message from the market. But I think your comments are right about like, we do need to probably, as we go to market in the public app store, we really need to tighten in like what is the problem that we're solving in our description. I agree with that. Thank you.
Yeah.
Great. Other thoughts or questions? I was wondering, Matt, did you get connected to the Notre Dame students through the university's Idea Center or some sort of program that's offered at the university?
I got in connection with them through my wife's cousin, whose son is one of the two developers. So I do have, I have some pals back there who are now faculty members and everything. So we have talked about that. We haven't really aggressively pursued, the Idea Center. But if you know more, John, I'd certainly be interested in talking about it as well.
Okay. That's interesting. Thank you.
And can I give, if I can have like 2 more minutes, I want to give a bit of a shameless plug for one other thing that we're working on these days, which is really kind of an offshoot of this. But, we both through the process of trying to find the right post-high school place for our son over the last couple of years, and then also talking to all these amazing directors of these college autism programs that are out there. I think what we found is there is information available. It's very scattered. And each of these programs, I mean, the great news for parents like us is that more and more universities are adapting programs like this. So, I think if you look back, there's now over 200 of them in the United States. If you look back a few years ago, there were probably only, 50 or 100 of them. So more universities are opening up to like, this is an underserved potential set of students that have a lot of ability that just needs some extra help. So actually this morning we are launching a YouTube page, a YouTube channel where I'm utilizing the contacts I've made through Routine Success and doing short interviews with these the directors of these programs to try to give parents and counselors a little bit of look behind the curtain, because again, they're all very different. Some are free, some are $5,000 a semester. Some they help with housing, other ones don't. Some they very much have an attitude of like, we want mom and dad involved. Other ones are like, mom and dad need to stay the heck out of their business because they're college students now. So unless you really like sit down with that executive director, it's very difficult to understand what services are actually involved. So I'll put it in the chat as well. The name of the channel is Inclusive Academia. We posted the first couple, one with the director of Ohio State and the other one with the director of the University of Tulsa Pathfinders program. We have several more videos, but they will all just be like short profiles of those executive directors and their programs, as well as more generalized, like what are some options for you as families for your neurodiverse, student as they graduate from high school. So.
No, that's a great idea. Thank you for sharing that, Matt.
You bet.
All right. Anything further before we switch tracks?
One more question, John, for Matt. Do you plan on recruiting mentors into the program just to have ones that aren't familial mentors in there? So there's kind of a pool.
Yeah, that's potentially an interesting idea. Not something we had thought of before. We were coming at it from a standpoint of, who are the folks that are already kind of in their tribe, right, supporting them. Now the app does allow multiple mentors, and mentors can work with multiple mentees. And we've actually over time built the functionality that not every mentor, like the first version of it was full kimono open. Like if you're a mentor, you can see everything that the mentee has built. But now it's actually customizable that, for example, if I am a young person who's a freshman in college, I may want my roommate to be my mentor on some things like social stuff, but I don't want my roommate to see that I'm also working on remembering to wear my deodorant and brush my teeth, right? So I can turn that mentor off for those routines, but have, if mom and dad or the counselor is working on different things, they can have different visibility. But that is an interesting idea, to build, as once we get more traction, build kind of a community of folks, some of whom might, want to reach out to like a neutral third party just to serve as their mentor. So interesting idea.
Thank you.
Great. We really thank you for being with us today, Matt. Really a great solution, and definitely part of the digital health ecosystem here in Kansas City. And as I said, I think kind of a growing hub for applications serving neurodiverse people. So it's a very welcome thing.
Thank you, John. Appreciate everyone's input today. Very, very helpful.
we've had at least one person join us since we started, so I'll give him a chance to say hello. That's Ryan Wright. Ryan, you want to introduce yourself?
Sure. I'm going to keep my camera off because I'm in a dark radiology room. But yeah, I am the ambassador for blockchain and healthcare today, the international magazine that publishes peer-reviewed papers from doctors and universities. We have now been published on PubMed and are successively getting larger and larger. The value-based work stream for health, P4 and P5, we are about to advance to the EU USAI, part of the IEEE. So hopefully we can get a lot more information on that. And I'm also the CEO of Envelope, who we are just now getting our MVP built, and we'll be able to show you guys that someday soon. That would be great.
Great, thanks, Ryan. Is there anybody else who's joined us since we started? All right, let me then jump tracks here and introduce Dr. Bob Dudzinski. Bob's application we've had a chance to see before, but there's been some growth in that environment, and we welcome him to share that with us. Bob?
Thanks, John. Appreciate it. Hello, everyone. And again, Matt, super presentation. The passion that you have for that obviously is fabulous, and certainly wish you best of success with it per se. So
I appreciate that.
You bet. So yes, we've had the pleasure of being here on Casey Digital Dive before, and ironically enough, my oldest son ran into John down in Kansas City, and John was kind enough to force me to come back on and say, give us some updates. So here we are today. So for the group, a little background. I do have my doctorate in pharmacy, participated in a variety of different disciplines, and owned, operated, and sold a variety of different companies. But for today's discussion, probably the most relevant one was, in essence, I had a company that was acquired by a large publicly traded telecommunication company, about $2.5 billion top line, about 45,000 employees. However, they had no focus in healthcare. So when they acquired my company, they asked me to come in and build and lead a healthcare practice. So my job prior to the formation of Digital Conversation was really to go across the country and talk to CEOs, CTOs, CMOs, CNOs about the importance of communication in healthcare. And this was right before the Affordable Care Act. Well, hence West got acquired by Apollo Global, and the pieces were found to be worth more than the whole. And so in essence, I took some of the engineers with me, some of the people I enjoyed working with, and we started a company called Digital Conversation. And this was the first time that I had got an opportunity to meet John. And really, we started Digital Conversation on two observations inside of healthcare, at least at that time, which was the underutilization of digital messaging inside of healthcare. And what I mean by digital messaging, everything but voice, whether that be texting, secure messaging, secure video. And then what we also recognized was the tremendous amount of utility that texting has for the delivery of secure web-based applications. You know, where an organization may not necessarily have a mobile app, but yet they still want to achieve an edict inside of their organization, and they want to connect and they want to deliver an extension of their value proposition out to a constituency. So that's what we recognized, the opportunity inside of Digital Conversation. So with that, I'm going to pull up a short slide presentation, and I'll give you a little bit more context as to what we do. And to John's point, some of the additional products that we've launched since our last conversation that really has been an ask of the marketplace and a recognition of where the marketplace is with respect to need around a digital ecosystem. So I'm going to share my screen here in just a bit. I'm assuming everybody can see that.
Looks good.
John?
Yep,
Thank
looks good.
So quickly, what I'll do is I give you a little bit of background on digital conversation. I'll talk about a little bit about our approach as a platform strategy. And people often ask us, well, why do people engage digital conversations? So we'll talk about, the feedback from our customer base. I'll talk a little bit about the segments that we serve and give you some use cases what's inside of those segments that are proliferating, so to speak. And then trends in digital messaging. I'll talk a little bit about patient-initiated texting. I'll talk a little bit about the state of carriers, its relationship to an entity called the campaign registry, a little bit about TCPA activities across the country, and kind of what we're seeing totally from the evolution of messaging. And then certainly at the end, I can take any Q&A or certainly interrupt me as I go through this. So again, what are we offering? Well, we're really offering a secure cloud-based platform where organizations need to engage their constituency digitally. They may not be doing it today, or they may be doing it very minimally. They have legacy systems that actually may be doing part of that, but they need a level of interconnectivity within inside of their organization to really achieve their business edicts. And really what we focus on is what are the things that we can do with this platform really to help an organization drive top line revenue, lower operational costs, and certainly communication costs. People ask me, what is a platform strategy? And really how we look at it is it's a comprehensive approach that we try to integrate the multitude of interactions and transactions that occur within inside of an organization amongst users, departments, and really bringing out the value exchange within that digital ecosystem. Said in simpler terms, most organizations have a tremendous amount of applications already residing within their organization. Some of those applications don't oftentimes reach their potential, or there may be need to talk between applications or leverage interactions between applications. So that's really how we approach our organizations, is an understanding of where they're at, what they want to accomplish, and where our ecosystem can fit inside of their organization. Who do we serve? Our client base today, and quite frankly, when John and I first met, I think we had probably a half a dozen clients. Today we've launched across a variety of different segments. So we deal with value-based organizations, ACOs, critical access hospitals. We deal with call centers, medical supply companies, diabetic supply companies, pharmacies, insurance companies, and physician offices. But more importantly, let me give you kind of an idea of use cases within inside of each of these organizations. We have a large ACO, about 65,000 Medicare recipients, who had a variety of technology solutions within inside of their organization, but the simplicity of asking their population to do an annual wellness visit digitally, they were void of that. So literally they engaged our platform to reach out to this population and schedule an annual wellness visit. Critical access hospitals, oftentimes challenged with resources, always need a tremendous need for new revenue. So again, it holds the same success that we had with our ACO, where we can consume data, reach out to a population, and drive a certain revenue opportunity for an organization. Call centers, where organizations want to mitigate voice. So we have a large publicly traded organization where within their filings, they made a bold statement that they wanted to move from 70% voice to 70% digital. And a lot of it has to do with the amount of utility, the amount of cost savings, the ability to reach more people, the opportunity to be multi-threaded in the engagement rather than single-threaded on the phone. So a lot of the organizations that have call centers tend to engage our platform as a strategy for mitigating voice. Medical supply companies and diabetic supply companies, we have a lot of them across the country. A lot of them need to be proactive in their outreach for new orders. And so we've developed products that allow us to take and ingest data from these organizations, serve it up through the text channel, have patients authenticate, and then deliver to them a very comprehensive opportunity for them to select the orders or products that they need, consume it back, send it back to the originating platform. Pharmacies. Pharmacies also struggle with the ability to do outreach, to ask for a refill. So we take that same technology where they may not have a mobile app, but we consume their future refills, send out a text message at scale, allow the patient to authenticate, and then present to the patient a very comprehensive review of their patient profile, allowing them to reorder and also attest and acquire any additional information that the pharmacy may need in order to diminish nuances that exist there. Insurance companies, again, the same, where they have a constituency, they need to present information to reacquire or acquire transactions. That becomes a focal point for us with insurance companies. And certainly physician offices, whether it be appointment reminders, diabetic management, wound care management, those are all opportunities for our platform to deliver on. I'm going to pause there for just a minute, and hopefully I've given some structure to what digital conversation does.
Yeah, Bob, that's great. I particularly am interested in the pharmacy angle because I've run into so many problems with my own over the past year. It would be much more effective if they were more on top of my prescriptions, frankly.
Yeah.
Have you found that there's kind of a sweet spot for your offering?
Yeah, I think with respect to pharmacy, it is obviously it's an intense environment for a pharmacist. Certainly there are mobile apps out there that a lot of the pharmacy applications deliver. But I think what we are trying to promote is the ability for a pharmacy to be proactive in the request of refills from a population, therefore achieving medication adherence. And so, again, just to kind of add a little bit more meat to the bone, what we do for pharmacies is we consume their future refills in our platform. We then send a link to those associated patients that have those refill orders, allow the patient to authenticate, and then present to that patient a profile, a detail of their prescriptions, including directions and doctors and day supply, and then allow them to select, submit, and then integrate that directly back into the pharmacy. And what we're also seeing is as pharmacy also is going through a bit of an evolution in the context of, we've had lots of challenges at some of the major chains about workload. So we see pharmacy taking on different personas across the country with different types of opportunities. And so we also have recognized in our platform. And so where pharmacies want to do more consulting, pharmacogenomics is starting to play a significant role. Building a platform that allows them to achieve success in that area also has been a very important sweet spot for us. But the whole notion of proactive outreach really has been a sweet spot across all of our healthcare segments, where there is a need to reach out to a population, deliver information, have that patient act or attest to that, and then consume that information back into the actual platform in and of itself, has really been a sweet spot for us within the last year.
John, if I can ask a question, I was curious. This is John Travis. Dr. Dzinski, very much needed. I guess two questions, because this is not a criticism at all. This is a lay question and curious how you differentiate it. This is an area that I know a lot of developers have focused on, trying to do messaging in different ways. I was at Cerner. We tried to do it in certain ways related to scheduling, reminder, wellness reminders for things that were gaps in care if they weren't going serviced. So I wonder how you differentiate yourself from what existed or what you discovered about what existed. It sounds like you're a richer, more comprehensive scope than some of those. And second, maybe this is a pitch, but I'll say it anyway. There's what you do is probably covered by HIPAA as well as covered by other regulations and laws that prevail on how health information is shared. I assume there is electronic personal health information in the messaging you do, so that's a concern for you. But just, what kind of regulatory environment did you encounter or have to not overcome, but address requirements of in terms of your launch?
Yep. Yeah, John, let me start with your first question around differentiation. It's a great point. What we have recognized is there's very, very good point solutions out there in the marketplace around messaging. Maybe somebody is really, really good at patient intake, and they've in a hospital system has chosen to purchase that platform. But then what happens is there are other outreaches that need to be done that maybe doesn't become an opportunity for that application to do. And that's really where we come in, where we can look at an organization and build around their workflows and really maximize the existing workflows, maximize the existing investments that they have in their legacy systems, and really try to augment the organization in total. So I wouldn't consider us a point solution, and I think your comment about being more comprehensive is actually how we approach it, which is, I know that you are doing things inside of your organization that you need help with, and I know that we can do this at scale and capacity, and I know that we can diminish the amount of costs associated with doing this on how you're currently doing it today. So that's really what's been our approach with these organizations. Now, with your second question with respect to HIPAA and other regulatory environment, what our platform does is it probably, we have a variety of different delivery methodologies. We do campaigns where we consume data and do large outreaches. We have something called pathways, where we allow our actual user on the platform to create and construct a text message and put it on a calendar and prescribe it to a patient. And then we have the ability for the user to really engage in just a simple chat with a patient. To your point, as in healthcare, there comes a time when that conversation is elevated to a point where HIPAA should not be, or PHI should not be discussed. Well, within our platform, we have the opportunity to move into secure messaging, both synchronously and asynchronously. And when I talk about that, and this is typical, a nurse or a pharmacist or a doctor will be engaged with the patient. Patient wants to share information. Doctor doesn't feel comfortable. Pharmacist doesn't feel comfortable. Nurse doesn't feel comfortable. So immediately, without DCing the conversation, they can send a link to the patient via the text channel, which they were engaged in, and then move them off the carrier into a secure chat function where the elevated conversation around PHI can continue, recognizing that in-flight is encrypted, at rest is encrypted, and then there are within our platform, the ability to keep that conversation secure and individualized as well. And in addition to that, we have a product called Hub Messaging, where the user can actually create an asynchronous message. By definition, the ability to store and forward it, very similar to secure email, because again, the conversation continues, and maybe the dissemination of a lab value needs to happen. Well, within our platform, again, we leverage the text channel. The user can craft a message, add a document, send a link to the patient where they authenticate. They can actually see the secure message at their leisure, download the document, and in reverse, through the text channel, request a link, authenticate, and then send back to the organization a message and/or a document. Kind of adapting to what I would consider some of the shortcomings of secure email, where oftentimes it's very difficult for a patient to initiate a secure email, where in our world, it becomes a way of doing that. But HIPAA is one thing. The other environment that we're dealing with today too is the world of TCPA, campaign registry, and I'll talk about that in a little bit more detail. But because the FCC declared texting an informational service, it gave a tremendous amount of power to the carriers to filter and block text messaging. And you may not even know this, but we have two types of services out there. We have telephonic services where by law carriers are required to create the end delivery of the message. Texting as an informational service provides a lot of latitude for the carriers to determine whether or not a message will be delivered. Again, a lot of this became the precursor to the development of an organization called the Campaign Registry, by which we're trying to create brand trust and mitigate robo-texting out there as well. But again, it is not fraught without challenges as well. We have healthcare organizations that, as an example, sell CBD oil. Quite frankly, if you put CBD in a text message in an A to P application or a 10DLC number, that message will get blocked by the carriers because, again, it doesn't conform to their particular policies. And as you can imagine, that has ramifications for a lot of messaging in between organizations. So the environment is at a very tenuous area right now. I'm hoping for the good, because again, we need to make sure that our engagement with populations are trusted, and we get the necessary outcomes and the behavioral changes that we're looking for. So, but again, it's not going to come without some challenges down the road. John, I hope that helped.
Yeah, I had to unmute, sorry. No, that was a very helpful answer. Your point of differentiation, I can certainly understand. You're right about the amounts of point of care. Everybody has their messaging solution, but it has a narrow scope of purpose, and it only interacts, within its own context.
Mm-hmm.
I imagine from the recipient's experience, they would prefer not being interacted with by 7 or 8 applications, all sending them messages.
Another good point. And, we have, and that in itself is a challenge for an organization as, carriers start to, they want to have brands conform to things like number of messages per day, no after hour messages, messages within a dispatch window. Those all now become important processes that have to be in place, for an organization not to create fatigue amongst their constituency. So, very good points. Very good points.
Doug.
Yeah, I'm very interested in this topic. I've been managing my mother's, who's 87's medical medicine, and making sure that she's taking it twice a day. I look at her insurance, so I have access to her insurance. Making sure her my charts and just following all the processes. So from going back to the, like a lot of times a family member is an elderly person's case manager. So would be interested in your thoughts on how this could help the, family members who are, doing the case management of medicine. One comment is the World Health Organization says 3 million people a year die from medical errors, and 50% of that is due to medication errors. And so, making sure that you're taking the medication properly, on time, not taking too much, not taking too little. Also following up on, the prescriptions. And a lot of times prescriptions get prescribed at a hospital and need to be, removed from the system. Like one thing I found was my mother, there was an auto sending of medication. So she got extra medication when she really didn't need it. So managing medication, I'm finding it can be a challenge, and my mom doesn't even take that many pills, different medications. So, how to manage this, for pain, for acute pain management that you get. And also she has like 4 different pain medications and so forth. What I'm observing is there's a need to really have a case manager to really look at the situation. In fact, my plan was to go to my pharmacist and say, okay, here's everything my mom's taking, making sure there's no, interactions that I should be concerned about and so forth.
Great question. And a historical challenge since the dawn of time. And I think, and to kind of put some additional context to it, the need to do a comprehensive med review for patients is critical. We have Medicare who incents on that. We have organizations, quite frankly, large one in Kansas City, that promotes the notion of comprehensive med reviews and identifying products, prescriptions that need, additional attention. The challenge that we have in the pharmacy space is, the amount of availability and resource to do that effectively. And I think that's also been kind of one of our goals. How do we take, and it doesn't have to be a pharmacy, but how do we allow a healthcare professional to do more with less, but still create that level of personalization and intimacy that achieves what we're trying to accomplish. So in the case of medication review, how do we effectively schedule a resource? How do we effectively get that patient engaged? And then how can we serve up for the data to the patient, whether it be prescriptions or some other information that they can attest to, and we can actually make change, or making sure that the patient is taking what they need to take. So in our world, I don't have a great answer, but what I do know is that we can, begin to build systems that better leverage the resource of a healthcare professional to engage the engage the patient in a retroactive approach, but do it with more information. But as importantly, and this is a place that we're also focusing on, we're talking to a variety of different pharmacy application organizations where, today with inside of a pharmacy, the intensity of being able to do counseling or get ahead of the curve when a patient takes a prescription is very difficult. So we have organizations that have proliferated successfully, like Outcomes, that retroactively give us information about medications that a pharmacist should do an outreach to 90 days after the fact.
Bob, we lost you.
Am I still here?
Yeah.
Now you are, yes.
Sorry about that. Why don't we create something proactive, even prescriptive, where at the time of dispensing, we can put them on a scalable messaging system that we can create a level of personalization to that keeps the patient engaged and adherent to whatever the therapy is. And so, we're not only talking to organizations like Outcome, we're going back to payers as well and saying, listen, most of our work here is retrospective. Let's find a way to do it proactive. But we have to do it at scale, and we have to do it against the resources that are available now inside of pharmacy. And that's just not pharmacy. That's across the board for all segments of healthcare. So, the question, our platform, really is a B2C play, and so we don't have a lot of consumer to consumer interaction on our platform. But I do believe that we can achieve some of those challenges or better results in the challenges that you've identified, which is, how do I keep my mom on the right meds, taking them at the right time, and, surveilling her successfully, but at the same time, continue to meet the business edict of profitability that I have inside of my organization. So again, a constant challenge out there. And that, again, kind of comes into our play as our comprehensive nature at looking at workflows and deciding how best we can, mitigate some of those challenges.
Great, thanks, Rob. Did you have further, yeah, there we go. Wanted to see what you'd like to cover.
Yeah, I'll just go quickly through these. So again, simple reasons why people engage us. Mitigate voice. They don't want to add more staff to their call center. And they also want to leverage a digital messaging channel. And we have some proprietary ways also of handling responses. Let me give you an example of that. When an organization can send out, as we do, 100,000 messages a day from an organization, they may have 25 people onshore, offshore. Not everybody should get that message, although it's going out on the same number. So we do a lot of work around response management for call centers, able to drive an inbound message to a certain pool or group of people. They want to reduce headcount. They want to do proactive outreach. I've talked about that. They want to do more with less, and they want to diminish paper exchange, particularly in our medical supply space, where we digitize their forms. Our platform allows a delivery mechanism for those electronic forms. They can get those signed efficiently and effectively, and then they can fulfill the order. So again, kind of changing the dynamics on some of those types of organizations. But these are really the 5 top reasons why organizations engage us. And I talked about hub messaging. And again, this became the basis by which now a lot of our products are built from, where we can consume data or a user can create a message, patient authenticates, and then we can deliver a secure environment, secure app by which they can interact on and know that can become very portable for them. And then that led us, I think I talked a little bit about, the ability for a user to chat. That led to secure order and secure RX forms and signatures. And again, these were some of the things that the last time we were on have changed or maturated here on Casey Digital Drive. And I think I've talked about this also, but let me just add a little bit more meat to the bone on all of this. Patient-initiated proactive texting. What I mean by that is historically, messaging has been somewhat always unilaterally generated by the organization. Well, oftentimes a patient would like to generate a message to the organization, and have a much more engaging approach. So we're seeing a lot of that. How does that manifest for us? I talked about secure order, where an organization can proactively send out a link to authenticate, to display orders. Well, the reverse of that is a patient can text back in a word that allows the system to serve that up back to them, with the patient initiating that. So we're seeing more and more of that in the marketplace. I talked a little bit about the challenges around the environment today, both regulatory and operationally, whether it be HIPAA, TCPA at the state level, the challenges around campaign registry, and then labor shortage. How do we, again, do more with less? And then we're seeing a lot of call centers making those same statements as our publicly traded clients, saying, here's how we're going to save costs, and here's how we're going to drive revenue. And again, a lot of that is around mitigating voice, not saying that voice isn't an important channel, but more importantly, saving it for complex interactions where routine interactions and maybe some intermediate interactions could be done digitally. So that's what we're seeing. I'm not going to bore you with this, but this is a real cost. This is a real ROI for an organization, call center that had both on and offshore activity, and also engaged in a proactive approach to the products that they were selling. And I'll share that in a slide. And if someone wants additional detail on that, I can certainly provide that. So, John, that's it for me.
That's great, Bob. Thank you very much. Any further questions from the group? We've had some good ones so far. Are there others?
Hi, this is Amy Tusky again. I have really, it's more of a validation of a use case on the physician offices side of it. Are you seeing more traction with like independents? And I ask that because my daughter just had ACL surgery, and what would have been really great is if there would have been a proactive outreach around like all the timings in the discharge summary, like 2 weeks post-op, a week after you're supposed to do this, or remember that, you can't, and I feel like this kind of goes into a little bit of what Matt was doing. She's a student at University of Arkansas. And so getting her to do these things, it's like that, it's a thing. So, instead she calls me and I read her discharge instructions and remember to do this, kind of thing.
Absolutely. And I would say that's in two contexts. It's kind of why we built pathways, the ability to recognize that there's a protocol for someone who's engaged in a procedure, or whatever the case may be, where you need to assess and evaluate over time and deliver information and maybe co-educate a patient. So hence we built pathways. And so the answer to your question is, do we see this in physician offices? Not so much, but we do see it in other organizations where they want to touch base with an individual and make sure that they're heading properly down a path. And so pathways to us is an excellent opportunity where you don't necessarily need a mobile app. You still want to engage them in a channel that is highly adoptable, but you need to disseminate information to them in a timely fashion. Let me give you two examples of this today that's actually happening in our world. We have physician offices that are providing shots for shingles. So, and shingles is a 2-shot immunization. Well, what happens in our world is we get the data that the patient got the first shot and we put them on a pathway. And basically what happens then, without interaction, 3 days later, a message comes out and said, how you doing? Are you having any side effects? Do you have any pain in your arm? And then 30 days out, a message says, hey, checking in. It's 30 days. Don't worry. We're going to remind you in the next 30 days to come back in. At the 60, or actually at the 50th day mark, another message goes out that says, time for your Shingrix shot. And then persistence occurs until the doctor provides us data back that relieves us of that, and then we compliment the patient on their success. So that's a pathway that's developed and prescribed to a patient. Alternative to that, carbohydrate diets, or lack thereof, have become a very popular approach. And so we had a physician create a 70 message, 28-day pathway. And really what it was meant to do was to augment the ability to go on a low carbohydrate diet and provide support, encouragement, assessment along the way, delivering information about protein and carbo count, and also asking them how they're doing, and also encouraging them down that particular path. So there's a lot of applications around being proactive in an approach around messaging. Hopefully that helps.
That does. Yeah, stay with physician offices.
Yep. Good.
Great. We have maybe a question, time for one more question. Is there anybody in the group who'd like to?
Yeah, John, I was gonna say hello. So good presentation, Doc. This is Jeremy Elias, founder and CEO at TrackMy. We do a lot of work actually with outcomes. We do a lot of work with community-based pharmacies, all around driving employee health compliance within healthcare and health systems. So curious, one, I'd love to jam with you. And the thought around, we're working on some pathways per concepts to identify immunization gaps in routine care, drive those individuals to community-based pharmacies, et cetera. So I think there's some opportunities to work together, and love what you guys are doing. So I don't know if John, if you have doctor's email that you'll share, et cetera, but love to talk about it.
I'll make sure I get it to you, Jeremy. That's great. I would love to have that conversation. Important area. Absolutely.
I don't want to miss an opportunity, John. Dr. Duzinski, this is Steve Sewell, and I work for a company that does pharmacogenomics. You mentioned it earlier. And as you know, the barriers to adoption, unlike the rest of the world where it's moving pretty quickly, in the United States, a little slower, a lot slower, because not just reimbursement, because also the integration challenges within EMR. So when you have a doctor who's already spending hours a day documenting and tracking and interacting with the systems inside the hospital, to have another system they have to go and access to find out if there might be some kind of an issue, when a simple alert system or some integration of AI letting them know, hey, that prescription you're looking at may not be the optimized one for that patient. Some of the capabilities that I hear you talking about would seem to really play be an opportunity for healthcare systems to integrate pharmacogenomics into what they're doing. It's not just with the drug to gene, but also the drug to drug is all encapsulated in some of the systems that we use.
Absolutely. And by the way, I'm fascinated with the pharmacogenomics. I mean, that space continues to explode, not only from the lab perspective, but also from the pharmacist perspective, and the communication and the interrelation of communication is relatively complex. So I do think we'll continue to tease out where we could play a role in facilitating some of those challenges that you've just mentioned. I would love to have a deeper conversation with you on that.
I'll follow up. Thank you very much.
It would be really fun. And by the way, for the group, I put my email in the chat. So obviously feel free to reach out and we'll get something scheduled.
I'll leave things running for a few minutes while after our close here, so that people can copy down any necessary information from the chat. We also publish the chat sometime during the month following as well, so you have access to it again later. But with that, I'll say thank you very much, Bob. It was great to hear your update. It really does seem like a great opportunity for doing some very proactive things in healthcare, which is vital and really important to the things that we're doing. So thank you very much for that. And I'll say thanks to all of you for joining us today. I look forward to picking it up again next month.
Thanks, John.
Bye now.
Thank you, John.
Thank you.
Everyone.